Hello, everyone. Thank you for joining our LinkedIn live stream event. My name is Colleen Hutchinson, and for background, I'm a medical editor and publishing consultant, and I'm very excited to be your moderator today for this live virtual event. Many advances have been made regarding research and treatment options in the field of dermatology over the past couple of years, which is evidenced by some critical advancements in care for various conditions. Today, we have three thought leaders with us who can speak to some of these treatment advances and also share with us some of the pearls that will be presented in more detail at the upcoming virtual 22nd annual Las Vegas Dermatology Seminar, which is this November 10th to the 14th. These faculty, who I thank for being here today, serve as co-chairs of the annual LVD seminar. They are Dr. Linda Stein Gold, who's the Director of Dermatology Clinical Research for the Henry Ford Health System in Detroit, Michigan, and is also Division Head of Dermatology for the Henry Ford Health System in West Bloomfield. Dr. Michael Kaminer is Associate Clinical Professor of Dermatology, Yale Medical School, and Adjunct Assistant Professor of Medicine, Dermatology at Brown Medical School. Lastly, we have Dr. Joe Fowler, who is the Clinical Professor of Dermatology, University of Louisville School of Medicine. Thank you all for being here today. Our first question is for Dr. Kaminer. Dr. Kaminer, on day 5 of the LVD seminar, we have aesthetics. What's new regarding injecting techniques with neuromodulators that attendees will learn about?
Well, thanks, Colleen, for having all of us here. I think the world of aesthetics has evolved, certainly during the pandemic. We've had a lot to deal with, both in general dermatology and aesthetic medicine. What's interesting specifically about your question on neuromodulators is some of the evolution of neuromodulators is starting to trend towards more natural results. And you would think, well, of course, we've been producing natural results for years, right? That's the whole point. But the reality is we've all seen people both on TV and the media, friends who've been overdone, overfrozen. And that's not an accident. Those things happen for a reason. I think we now, and for years we have, but we're starting to understand better why people look overdone. And I think what people who attend the session will hear is, how do you make people look natural predictably? We'll also talk about some of the new neuromodulators that might be coming. So even though it's sort of an oldie but a goodie, there's a lot of interesting developments in neuromodulators that I think we all can learn from.
Okay. Regarding a targeted approach to addressing cellulite, what is the most important advice you would give practicing dermatologists today?
Well, cellulite is near and dear to my heart because I've done a lot of work in the research side of it. But the bottom line is this is not your grandmother's cellulite anymore. Well, I guess literally it's not your grandmother's cellulite anymore. We now understand a lot better what cellulite looks like, what causes it, and importantly, how to treat it. And in addition to that, we now have multiple FDA-approved treatment options for cellulite. So we'll talk a lot about the nuances of cellulite, what differentiates one kind from another, how do you tailor a treatment regimen to a patient, and importantly, how to give results that patients are satisfied with and will last for years and years. So we have a lot of options, and we'll talk a lot about how they can be fit to each individual patient to give them the satisfaction they're looking for.
Okay, thank you. Dr. Stein Gold, on day 3 of the LVD seminar, we have the Atopic Dermatitis Forum. Your presentation is up first. Can you tell us a little about what's new in AD topical treatment that viewers will be learning about at the meeting?
Absolutely. We have to remember that topical therapy is still the mainstay of therapy, especially for atopic dermatitis. And most of our patients really have more mild to moderate or localized disease. And that means they can be handled by topical therapy. So I'll go over some of the basics like bathing. We all know that the soak and seal method is really superior in terms of cleansing and hydrating the skin, and really shows some data about why bathing more often is actually better than less frequently. We'll take a look at some of the possible prevention studies that have been done to see if we can change the natural history of atopic dermatitis. And unfortunately, at this point, I don't think we're there yet. We'll take a look at the drugs we've had, the topical calcineurin inhibitors, see how they compare to the newer drugs like the phosphodiesterase inhibitors. And then we'll take some time and really look into our new treatment options, especially the topical JAK inhibitors. We've had a very exciting update as we know that the first topical JAK inhibitor, a JAK1 and 2 inhibitor, ruxolitinib, was actually FDA approved just a few weeks ago. And so we'll go over that data. We'll look at how and when to use that drug. We'll also try to dissect out that box warning and try to figure out what does that actually mean for prescribers. And bottom line is this is a really effective drug that's safe as long as we kind of stay in our lane with topical therapy and use it as indicated, up to 20% body surface area.
Okay. I'd like to just add, we have someone who just joined us, Dr. Larry Eichenfeld, who is Distinguished Professor of Dermatology and Pediatrics, Chief of Pediatric Dermatology, and Vice Chair of the Department of Dermatology at the University of California, San Diego, and Rady Children's Hospital. Thank you for coming.
Greetings, everyone.
Greetings. You are right on time. I have my next question for you.
Okay.
What are some of the topics or presentations you most look forward to hearing about at LVD 2021?
Well, there's it's such a diversity of topics. It's hard to run through. Clearly, Linda was just talking about atopic dermatitis, and I do think that the timing of this meeting is important. We'll probably have approval of some of the oral JAK inhibitors. We've had the topical JAK inhibitor. We've had expanded indications for dupilumab that just have come out, both for dermatologic conditions such as prurigo, as well as for different age and asthma, and new data of dupilumab down to 6 months of age. So I think there's although indication at that age isn't there yet. So there's some wrestling in the field in terms of figuring out how we're going to be sort of translating new medicines into our regimens of care. In pediatric derm, I think we got some what I sort of mixed clinical case presentations where we always learn from our patients, but discussing some of the, here's an odd case, is it life-threatening or not life-threatening, as a way to tune up our clinical scenarios. And then also, just the basics, going through, we've had a few new medicines in acne vulgaris. Has it changed our what we go to for our patients? I think there's a lot that's moved on in the field, and it'll be exciting to get such great faculty together to discuss it.
Okay, Linda, would you like to add to that?
Yeah, I think Larry gave a nice summary of some of the exciting things that we're going to expect to see. But there's so much. I mean, the agenda is action-packed. We traditionally look to this meeting as a really comprehensive overview of what's new in psoriasis, and we still will be delivering that as well. We're going to talk about psoriasis from all different aspects and kind of bring you up to date, just like we will now with atopic dermatitis, as Larry mentioned, kind of from the beginning to the end, of really a holistic approach to each one of these conditions. But we're going to talk about hidradenitis and some viral diseases and sweating. And of course, there's going to be a lot of just other mix and match. So I think it's exciting. I really look to this meeting to kind of bring me up to date on what's new for me in medical derm.
Dr. Feller, would you like to add anything?
Sure, Colleen. And as a matter of fact, the first thing I'd like to actually add is that I had these quick glasses before Larry did. So I still need them so I can see. And Larry evidently doesn't really need them as much as I do. I think what's been said about what's coming up in the program is all absolutely correct. I always, at any of these meetings, learn things, even if it's an area that I don't really pay attention a lot to in my own practice. So we always have speakers that are basically on the cutting edge of what's going on in all these areas. And I'll mention one thing that hasn't been mentioned actually is the case reports from the local physicians, the local dermatologist in Las Vegas is always, to me, a highlight. They may not have all the scientific background that some of the regular lectures have, but they are delightful cases and very instructive, and they're always presented very well. So that's another highlight for me of this meeting.
How about the cosmetic update?
Yeah, that's something, Michael is in charge of. And for us, we're more medical derms, but I think it's really important, especially for me, to have an update on what's new in cosmetics as well. So what I appreciate about this meeting is I get the update on medical derm, I get the update on pediatric derm, I get the update on pigmented lesions and such, but I also want an update on what's new in cosmetics so I can make sure that I'm kind of at least understand the cutting edge.
Mhm. All right, well, we'll switch gears a little bit. And Dr. Fowler, I have a question for you. One of your topics is the skin barrier, and another is new oral agents. Can you share a little bit on what attendees can look forward to with regard to both of these presentations?
Sure, absolutely. So to build a little bit on what Linda started us off with in our discussion here, the skin barrier and topical treatment of atopic dermatitis, I think, is still critical. It's wonderful that we have new medications that are on the horizon or that are just approved, as Linda said, but a lot of it still goes back to a defective skin barrier. We can't really fix that. We can't really correct that skin barrier entirely, at least until we have some sort of genetic modification, if that ever happens. So we have to do what we can with topical treatments, with moisturizers, with maybe adding back some of the components that are lacking in the skin barrier that can be added back in through topical therapies. Most of what we're doing with our new medications address the inflammatory component of atopic dermatitis. But I think we still have to remember that skin barrier component is very important. So I'll be talking about that. I'll be talking a little bit about some topics that are somewhat related. Bathing, Linda mentioned, laundry. Our patients seem to always think, well, it must be something in the laundry. This detergent I can always use, and that detergent I can never use. And we'll talk a little bit about that and where there's some facts and maybe where there's not. And clothing. We've recently been involved in doing some studies with very fine wool clothing, and you might think, and most of us would have thought, oh, atopic dermatitis, you never want to wear wool, but if it's very fine, soft wool, it might be okay. So I'm going to talk about a few of those things in that barrier lecture. And then in the talk about oral medications, the far and away the critical thing there is going to be the new JAK inhibitors that are hopefully on the horizon. They've been delayed a little bit due to some issues about potential adverse effects, not so much in dermatologic treatment, but when they're used for other conditions, which, as many of our viewers probably know, JAK inhibitors are used for other medical conditions such as rheumatoid arthritis and psoriatic arthritis and others. And there has been some concern about adverse events in those conditions. Now, in dermatology, maybe we'll be using lower doses. We might be using different medications that won't have as many of the issues. But the Janus kinase inhibitors or JAK inhibitors are certainly going to be coming. And I think they're going to really help revolutionize atopic dermatitis. I tend to, we're going to have some biologics as well that Larry will be talking about, but between the new biologics, the dupilumab we already have, maybe the topical JAK inhibitors and other new mechanisms of action inhibitors or topicals that are going to be coming. And then we're going to have the JAK inhibitors. And so all those are going to mix in. And I think the JAKs are going to be very critical going down the line for us.
Okay, thank you. Dr. Eichenfield, I'm going to swing it back over to you and ask you, what is one of your top 5 facts regarding AD from your upcoming presentation?
Well, so by facts, it's the FAQ. It's frequently asked questions. So I'm just coming off a clinic, and we've faced many of them, okay? So I think one of them is, will my child outgrow their eczema? Okay. And I'm coming to this session now with this lovely family who came for their 10-year anniversary. Their kid had horrible eczema. They drove from past hundreds of dermatologists on the way down. They're sort of north of Los Angeles. And they kept coming back, even though I told them I could send them a lot closer. But they came back. Essentially, the child's in total remission now. Okay. And has a occasional breakout every year of his eczema. And so that's a really good question, especially because we have a lot more data now than we did a few years ago, but not yet data that can allow us to predict if I saw him again, as in his first year of life, with the type of eczema that he had, would I have been able to predict that he would be someone who would be in extended remission in the future, or would he be one of my persistent frequent flarers? We're not there yet. So I think what I like about one of the fun things about being faculty with incredible co-faculty, like we have at this meeting, is that there's new information and data, but then it's the experience in the room with our patients and how we translate that at that time, and how we think also the evolution is going to go in our care. So I'm not going to give you the answer to that FAQ, but it's definitely one that I'm happy to discuss, and how it does influence. To be truthful, one of the comments I'll make, which is a big takeaway, really trying to have patients not treat their eczema as they wait for it to go away, but to treat the eczema so that there's really minimal disease, so it minimizes the impact on the individual. And in the case of pediatric dermatology, the impact on the whole family.
Well, thank you for sharing. I look forward to the entire presentation. I think that brings us to our end point in terms of time, so we're going to wrap it up. And I'd like to thank all of our 4 panelists for sharing their time and insights, as well as thank you to the audience for joining us today. You're going to hear much more on these topics and more during the 22nd Annual Las Vegas Dermatology Seminar next month. And again, that's November 10th to the 14th. If you have any questions, you can email me at colleen@cmhadvisors.com, and I can forward them to our faculty. Thank you, everyone, especially our panelists, and everyone have a great rest of your day.
Take care.
Thank you.